Welcome to another episode of Dr. Simone Says. My name is Simone Eastman Yuan. I am a medical doctor with sickle cell disorder. I am also the best-selling author of the books All Rise, The Sickle Cell Community versus the Medical Establishment, and A Doctor in a Patient's Body, Dreaming Big with Sickle Cell Disease and Chronic Pain. These days, I like to spend my time making sure that every sickle cell survivor becomes a sickle cell thriver because it matters that we live well. Hi guys, this is Dr. Simone here, and it is, it's Monday, March 2nd at 1:31 in the afternoon, and I am actually at the infusion center because I am going to get my first infusion of ADAKVEO, one of the two new treatments for sickle cell disorder. So that's the one they were calling Crizanlizumab, and then when it came out, they changed it to ADAKVEO. And so I am finding out that it is a 30-minute infusion, and when it starts, I will show you some of that, and then and I will keep you guys posted as to how I'm feeling, after the infusion. But I feel really optimistic that we have a treatment just for us, and I'm optimistic about what it can do. The preliminary studies and the clinical trials have been wonderful, and so I look forward to just feeling better. This is the one that's an infusion, and then it's supposed to kind of cover over all of the places on the cells that make them stick to each other, so that they don't stick to each other anymore, and they just pass through the bloodstream, just sliding by each other, which reduces their chances of clogging the vessels and causing a vaso-occlusive crisis. So that's how this one works. This is not increasing the hemoglobin like voxelotor or oxbryta. That's what voxelotor is called now. This one is different. So and of course that reduces inflammation and all of those things, because it would trigger the inflammatory cascade whenever our cells start sticking together. So I'm really looking forward to not having as many pain episodes all over my body. I tend to get a lot of pain, like in my long bones, like in the tibia and my chest wall and along my spine. So I'm looking forward to having less pain. All right, I'm gonna stop here, and then I will check back in when the infusion is up and running. All right, talk to you soon. Bye bye. Okay, guys, so I'm back, and this time the nurse has hooked up the ADAKVEO, and it is about to start infusing. My husband is videotaping, so he's showing you right now how it is hooked up. So it's basically piggyback to a 0.9% sodium chloride infusion. Now I know I have told you guys before about looking at the 0.9 versus 0.45, but if it is just as a flush, it is okay. It's too small to make a difference in terms of your body and what you need for hydration or fluid. But this is just to wash the medication through the line so that I could get everything. I just started, so obviously I don't have any feeling, it's too soon to tell if there is anything, but I just wanted you to see what it looked like, and I was told that I'm the first patient here that's started on it, and so I'm excited to see how things go. All right, talk to you guys again. Oh yeah, that's right. My husband is prompting me to let you all know that the infusion time is 30 minutes, estimated for for it from start to finish of the infusion. But obviously, with check-in and setting up and accessing our IVs and things like that, probably plan to stay or be there for about an hour, hour and a half, just to be safe. Yeah, all right, I'll check in with you guys again later. Bye. Hi, it's Dr. Simone again. And I am all done. As you can see, I am disconnected, and it really did just take 30 minutes or so. And probably the only thing I felt was like a feeling of needing to take deep breaths. I don't know if my heart was beating faster or what, or I could have just been excited. I don't know, but whatever I was feeling is gone, and it was very transient. So I'm all better and just ready to head home. So I will check in with you guys tonight, probably before I go to bed, and just let you know if I'm feeling anything between now and then again tomorrow, and then that'll be it. All right.
And any side effects?
So far, I don't feel anything. They say that that the common things that are on there are aches, back pains, and nausea, and things like that. But the thing is, with the aches, we're accustomed to having aches, so it'll be very interesting to see if the quality of the pain is different, and if I can tell the difference between a side effect or my sickle cell crisis. So we shall see. All right, bye. Hi guys, it's Dr. Simone again. I almost forgot. I am about to turn in and wanted to just update you guys on what I thought about my first day post infusion of the ADAKVEO. And I think I mentioned that when I was getting the infusion, my heart was feeling like it was beating fast, or I just felt like I needed to take deep breaths. I wasn't sure if it was what was happening in my chest, but I just felt like I needed to take deep breaths. And then I came home and I was super tired, and I went to take a nap. When I was towards the end of my nap, I actually woke up out of it because I felt really achy. And it's really hard when that happens, because you don't know if it's because of, just the events of the day and you're having just a mild flare, or if, that was the actual side effect of achiness that they talked about. But I just wanted to be transparent and at least include that it wasn't bad. And when I woke up, I was not so sore that I couldn't, move around. I did feel low energy, so I didn't, bother making dinner. We kind of just had something light and just kind of rested up for the rest of the evening. But that's all that I noticed, and I don't know what's to be tied with the treatment, and or what's just a day in the life of someone with sickle cell, and that makes it hard. But anyway, I have felt tired the rest of the evening, so I decided I'm gonna just turn in early. All right, and so on my way in, I decided to at least document this so that I don't wake up tomorrow and forget the details of what I was feeling the day before. All right, so I will talk with you guys tomorrow. Take care. Good morning, everybody. This is Dr. Simone here, and I am starting my new day, post-procedure, day 1 of ADAKVEO. And I woke up feeling fine. The fatigue of yesterday is long gone, and the aches were very transient, so I don't have any residual ache this morning. And yeah, I feel fine. Nothing to really report. So I just wanted to let you guys know that. And if anything, develops between now and the next infusion in a month, I'll let you know. But otherwise, it's looking good. All right. Talk to you soon. Bye-bye.
Until next time, this is Dr. Simone Says, and remember, you are a sickle cell thriver and not just a survivor. If you benefited from this episode any at all, please like on the video, subscribe to the channel, and share the video with one other person as your good deed towards the sickle cell cause. Have a great day. If you would like to contact me to speak in your area, please don't hesitate to email me at drSimoneSays@gmail.com. If you are the one referring me, please let me know so that I could send you a nice thank you surprise.